We've talked about excising it in the past, but we actually just drain it, aspirate it. It gets her a lot of relief for quite a while, right? 4 to 6 months usually. So she just comes in between her vacations and we drain it out, and it gives her the relief she needs. So what we'll do first, we'll kind of clean it off a little bit. Get her some spray, and then we're gonna stick the needle in there and start the draining process here. A little stick, okay. All right, so then you can kind of see here in the syringe all that cystic fluid that's coming in here. No pain, right?
No.
Good, good. She has quite a bit. Usually we fill up about 4 to 5 of these syringes with the cystic fluid. And basically we're just putting some pressure on the cyst itself because it's got a couple tentacles, if you will, that come up to here that are extensions of the cyst. So we want to make sure that we get it all out so she gets the optimal relief for when we do drain it. Once we kind of get to the point where we're not getting any more fluid out, then what I'll do is I'll actually disconnect this one and go to the next one. And this just helps to cut down on the amount of times we actually got to stick her. All right, same thing again. Get the suction, and then again you can see a little bit of blood, which isn't totally out of the norm with cysts. Doing okay?
Mm-hmm.
Good. So typically the most common spot for cysts to develop are pretty much right where hers is, across the top of the foot here, kind of in this whole general vicinity. They can be painful. Usually the reason they're painful, other than the obvious of trying to fit in a shoe, is the nerves. Those nerves are very superficial on the top of the foot. So sometimes it can rub and cause quite a bit of pain on the nerves, which leads to, whether it's shooting pains down to the foot or down towards the toes, whatever it may be, it can actually cause quite a bit of discomfort for the patients. Obviously this one's a little bit bigger than some you might have seen on our channel before, but again, she gets quite a bit of relief from it. Put a little bit of compression up here too to try to milk it out as much as we can. Oh, we might need that 5th one today. Get our money's worth, right?
Right.
All right, that's number 3. Maybe we'll be all right. Still doing okay, right?
Yes, I am.
You can kind of see it all coming through the syringe there as we go. And it looks like, based on the sounds, like we've finished. All right. So what I'll do now that she's all done, is I'm going to put a compressive wrap on her foot. That'll help prevent the cyst from filling right back up. She'll take it off tonight or tomorrow morning, and then go on with her life and give me a call when it comes back, like we've been doing. If you or your family member has a cyst and you need us to drain it or take it out, I'd be happy to help. Like us on Facebook.